Hey, good morning, everyone. We're just going to give a couple more minutes for people to transition into the meeting. We try to get started right at 9 o'clock, but I just noticing some lower numbers, so I want to make sure we have enough time for people to join before we get started. So hang tight, we'll get started in a couple minutes.
Can I hear anything?
Hey, babe. One in there.
Oh, I don't know.
Okay, good morning, everyone. My name is Tony Walton. I'm a section manager within the Division of Behavioral Health and Recovery, supporting adult substance use and treatment efforts, and here to chair today's Substance Use Recovery Services Advisory Committee for March of 2026. Thank you all for being here. We're going to go through some quick logistics around the meeting, and then we'll also do a quick round of introductions for who else is in the room, and then we'll get started. And so just some the reminders that we have at the beginning of every meeting. This meeting is being recorded and live streamed on TVW. We'll have all meeting materials, the recording on the SURSAC website. Given that it is recorded, and in most meetings, regardless, they are open to public disclosure requests. So please do not disclose any private or confidential information throughout the course of the meeting. Next slide, please. Just some ongoing reminders about language and terminology that we use. Now more than ever, it's important to honor person-centered language and ensure that we're using language that isn't stigmatizing substance use and substance use disorder. There's some resources that we have with our slides that we put on the website, as well as just some bullet points here about some alternatives to use to ensure that we're doing what we can to reduce the stigma around substance use disorder. Next slide. And guidelines for public feedback. We really welcome everyone to join these meetings, and it's great to see so many people that are interested in the work that's happening and supporting the committee and its efforts. And we try to dedicate time to ensure that there's public comment opportunities throughout the meeting, usually at the beginning of the agenda as well as the end of the agenda, and then also within each topic that we have, each presentation that we have or agenda item. We'll usually open it up for committee feedback and then allow a little bit of time for public comment feedback after that as well. And then, as always, public feedback can be provided to the email address hcaesb5476@hca.wa.gov. If you think of something after the meeting, or if you have a question about something that you heard during the meeting, please feel free to reach out. We do want to ensure that there's an open line of communication, and so appreciate anybody's comments, thoughts, questions after the meeting as well at that website or email address. Next slide. Okay, that's it. So we're going to do a roll call here in a second, but before that, I just want to do a quick round of introductions of who's in the room, just so you know who we have here at Cherry Street Plaza at 626 8th Avenue Southeast. I already introduced myself, so Michelle, I'll pass it to you.
Sure. I'm Michelle Martinez. I'm the SURSAC administrator and senior SUD project manager here in DBHR.
Good morning, I'm Tim Candell, I'm the Joint Health Advisor for Washington State Department of Health.
Hi, everybody. I'm Robin Zimmerman. I am guest presenting alongside Chris Stanley here. We're from Washington Courts, Administrative Office of the Courts. I am the External Relations Liaison and steer all outreach for the Blake project.
Christopher Stanley, I'm the Chief Financial and Management Officer here at the Administrative Office of the Courts.
Hi, Melissa Temke, she, her pronouns. I'm the ABA Behavioral Health Communications Manager.
And Alex Sheehan, Behavioral Health Program Manager in the Medicaid Programs Division in the BHASO contract unit.
Rachel Downs, and I'm the admin assistant with HCA assisting.
Thanks so much, Rachel, for that, and thanks everyone else for being here. I'm going to do a quick roll call to see who from the committee we have present today, and then we will a couple of quick announcements, and then we'll go through the agenda. So for the roll call portion of this, my favorite part, Senator Manka Dhingra, Senator John Braun, Representative Lauren Davis, Representative Brian Burnett, Caleb Bantha Green. All right, we're starting off 0 for 5. Don Julian Saucier.
Good morning.
Oh, hey, good morning. Great to see you. Alexi Orr.
Morning.
Good morning. And Amber Cope.
Morning, babe.
Morning, Amber. Randy Flood.
Here, good morning.
Good morning. Stormy Howell.
Good morning.
Chad Enright.
I'm here. Good morning.
John Hayden.
Good morning, everybody.
Nikki Lewis. Sherry Candelario.
Good morning.
Hi, Sherry. James Tillett.
Hi.
Present. Good morning.
Christine Lynch.
Good morning.
Sarah Gillard. See Sarah. Danelle Tanksley. Out. Malika Lamont. Okay.
Present.
Here we are. Hello. Addie Adwell.
Present. Good morning.
Morning, Addie. Hunter McKim. Representative Levitt. And Representative Manjarez. And I did see that Nikki Lewis joined. Nikki, good morning. Confirming, hear us? And pretty good turnout. Thanks so much for everyone for being here. Not a surprise that our legislative representatives for the committee are absent this morning with the amount of work that's happening over the next week and a half to close out the legislative session. But we still have a quorum with the number of people that were able to make it today. And so really appreciate everyone taking time out of your Monday morning to be present and engage in the conversations. Let's go over the agenda real quick. So we have time set for some committee member announcements, any public comments or questions. Then we have a colleague at the Healthcare Authority, Tyron Nixon, giving some updates on the reentry waiver. I believe our third cohort just went live yesterday or the day before. So exciting work happening around the reentry space and expanding our ability to utilize Medicaid to serve individuals that are incarcerated, which is just such amazing work. And then we have our guests that you've already met from the Administrative Office of the Courts here to talk about the Blake Refund Bureau and the work that's happening across the state to ensure that individuals that were impacted and fined under the old unlawful possession of controlled substance statutes are able to get their legal financial obligations refunded and getting that money back. They'll give you way more detail and helpful information than that. And then Chloe Wilkins is coming to talk about some updates around recommendation number 4 from the Substance Use Recovery Services Plan and the work that's happening for training for caregivers of youth with substance use disorder. And so look forward to that towards the end of the meeting. And then we're going to round out the meeting the last half hour with a legislative update. Sean O'Neill is going to join us from Legislative Affairs Office here at the Healthcare Authority and talk about some of the active behavioral health bills, as well as discuss some of what we're seeing in the budget proposals from the House and Senate. What are the next steps in terms of a final budget for the Washington State, a supplemental budget halfway through the biennium. So a jam-packed agenda, and I have about 2 minutes for other announcements, so I just want to flag a couple of things. One is we will be sending out today through our Gov Delivery announcement system a solicitation for behavioral health agencies to submit readiness assessments for cohort 3 of our contingency management waiver underneath Medicaid Transformation Project 2.0. So keep an eye out for that, an exciting opportunity to be part of the third cohort in expanding contingency management across the state. We have a great team leading that work with Laura Weed and others. And we'll include the Gov Delivery within the notes that we send out for the committee so everyone has access to that. I believe we're going to have a period open for about 60 days for interested behavioral health agencies to submit the readiness assessments and indicate their willingness and their ability to provide contingency management at their facilities. So great work happening there. And then some of you might have been tracking that there was an Olympic Heritage Behavioral Health procurement that ended at the end of the year, at the end of 2025, to expand substance use behavioral health services at Olympic Heritage Behavioral Health in Tukwila. And we're moving forward in that process. And so hopefully in the next meeting or two, we'll be able to announce an apparently successful bidder and let everyone know what new work is going to be happening at that facility. So a lot of work happening around that expansion of services and that competitive procurement. Can't share more, just wanted to make sure it was on everyone's radar. And then if we have time at the end of the meeting, I think with the legislative update, we may not, but just something that we've been talking about is, and working with our Office of Community Voice and Empowerment, is how to kind of like structure these meetings to, I guess, solicit more dialogue amongst the committee members and those that are attending the meeting. And so hopefully we can talk more. I know Michelle's been working with Dakota Steele at the Healthcare Authority, who's really leading work about community engagement and empowerment. We just kind of have some ideas about how to ensure that we create space like that in the future for future meetings. Because as a reminder, the committee sunsets at the end of 2026. So we're really trying to be thoughtful and mindful about how to best utilize the time that we have. That's only 9 more meetings. And so yeah, just wanted to kind of flag that. It's been a whirlwind, five years, almost half a decade. A lot of time, a lot of energy spent on this work, and so just really appreciate all of that. So thank you for letting me ramble through those announcements and the agenda overview. I'm going to pass it over to Blake to facilitate the meeting and get us through the next couple of hours.
All right, thank you, Tony. Good morning, folks. Right now, we are looking for committee members who have announcements about anything that's going on that they think others should know. So if you're a committee member and you would like to announce something that you're working on or something that we all should know about, please go ahead and raise your hand virtually. Any committee members? Okay. All right. Don't see any hands for committee members. So let's move on to public comment. We have a couple minutes set aside for public comment. If you're a member of the public and you would like to make a comment, please go ahead and raise your hand virtually, and we will call on you. Again, time for public comment. If you're a member of the public and you would like to comment, please raise your hand. I see no hands. Okay, looks like we can move on here. Tony, you want to introduce Tyron?
Yeah, and then, it's probably for the best that we didn't have any public comment or committee announcements, because I don't know how Tyron's going to be able to pack all of the work that's happening around the reentry project into 20 minutes. So it kind of worked out that we're going to have a little bit more time. Tyron, hopefully you're ready. We're a little ahead on the agenda. Just 7 minutes. Tyron, you there?
I'm here. Can everyone hear me?
Yes.
Yes.
All right, perfect. Yes, I'm here.
Okay, Tyron, before you get started, I noticed a comment in the chat from Steve that says your microphones are echoing to the point of annoyance and distraction. I don't hear it on my end. Is anybody else that's in the committee, can they confirm whether or not they're hearing feedback in the virtual world?
I'm not hearing any feedback.
No feedback on my end.
All right, so Steve, that might be on you. Sorry. Hopefully that gets resolved, and apologies that it's happening. Okay, I just wanted to address that just in case before we went any further. Tyron, thanks so much for being here, and it's been great working with you over the past year. I don't know how it feels like a couple years now, but you and your team have just been doing so much work around the expansion of services to incarcerated individuals underneath the Reentry Waiver Project for MTP 2.0, Medicaid Transformation Project 2.0. And I'm going to stop talking and let you give us an update on where all that work is at, and just really appreciate you being here on a Monday morning when the sun's out and the sky is blue. And just thank you so much.
Yeah, absolutely, Tony. Thanks a lot, everyone. Good morning. My name is Tyron Nixon, and I'm the Transformation Implementation Manager here at the Healthcare Authority. I'm within the Medicaid's Program Division. It is an honor to be before you today, and I will start bragging on Tony and Sarah. I believe she's in the meeting, and all the other staff. Rachel Mead, I could name off several others who have been instrumental in this work here. So it's been definitely a group team effort. And so again, thanks for the invitation. My purpose this morning is to provide you with an update on the reentry initiative, including where the reentry program has been implemented and which facilities, which counties, and what are some of the kind of initial successes that we're seeing and the challenges that we've been seeing as well. And what I'm going to do is have the administrator or facilitator go ahead to the next slide as we pivot over. Perfect. Yeah, go over to the next one. All right, excellent. Thank you. So for today's update, I just want to take a quick step back and just really set the foundation. Washington State was the second in the nation to have our 1115 waiver approved, and the approval occurred back in June of 2023. And when I talk about this program, I always ask the question, so why is this second in the nation waiver approval so important? And it's important because beginning July 1, 2025, last year, within 90 days of release, Washington State's Medicaid program, or Apple Health, will pay for a targeted set of pre-release services for Medicaid eligible adults and youth in our Washington State prisons, our jails, and youth correctional facilities. And really, the objective is to facilitate that access to essential healthcare services and case management to enrollees while they're incarcerated, to allow those beneficiaries to establish relationships with community-based providers from where or whom they're going to be receiving services upon re-entry back into their respective communities. And so what you see from this graphic here, participating facilities must provide clients with access to 5 mandatory reentry benefit services that can be reimbursed by Apple Health. And those services include our reentry targeted case management, substance use disorder, 30-day supply of medication at release. Then we have the pre-adjudication for our Consolidated Appropriations Act, or CAA eligible clients, the Apple Health benefits there. And then we have our post-adjudication, or our CAA eligible clients, clinical assessments and evaluation. And if you look to the right of the screen, participating facilities may offer optional services that can be reimbursed by Apple Health as well. Facilities may provide one or more of the following, like you see on the screen there: lab and radiology services, the clinical assessments or services for providers with lived experience, medical equipment and supplies at release. So it's pretty a big comprehensive list of items or reentry benefit services that are available to those that are reentering into the community. Let's pivot over to the next slide. Many of you may be familiar with this graphic as well, because it's been the timeline we have used to onboard facilities participating in the reentry initiative. We launched a capacity building program that requires facilities to really describe their existing capabilities. Are there any operational gaps and technical assistance needs that facilities have? Additionally, we used a cohort selection process and a milestone approach as well. And we put into motion, alongside all of that, a comprehensive readiness assessment process that requires facilities to really just demonstrate their ability to comply with all of the waiver requirements prior to going live with the authorized services. So facilities have a chance to attest for: can they bill Medicaid? Can they support the reentry targeted case management? There are some narrative statements that they demonstrate strategy, process, timeline for achieving those requirements. We were making sure that they have a staffing and governance structure in place. And again, are they able to support the medication reentry targeted case management? So it's a readiness assessment that is comprehensive, and we've been working with those facilities one-on-one really to help them meet the goal of the program. So where you see the dates and places there, I'm going to give you some exciting data here, because just you see milestone 1, milestone 2, milestone 3. So milestone 1, those that were participating in the reentry initiative, they let us know by June 24. Then there was cohort number 2 for November 1, 24, May 1st, 25, for those that intend to participate. And then you see milestone 2 and the dates where those cohorts, if you're in cohort number 1, capacity building applications were due October 1. And if you're in cohort 2, they were due April 25th. And so this timeline has helped us move right along. And it's really, really exciting, because right now we're in milestone number 2. for cohort 2. And those facilities launched here on January 1. But let's pivot over to the next slide and we can share a little more detail about this. So we had 12 facilities that launched in cohort number 1. 8 facilities went live on July 1, 2025, and 4 facilities went live on November 1st of 2025. And so just to give you some names here, you see on the screen, we got Spokane County Juvenile, Clallam facilities, meaning the county juvenile and family services, and the Clallam County Jail joined. Kitsap County, I don't know if Commander Penny is on, Walla Walla County Jail, Wahkiakum County Jail, Kittitas, Lieutenant Buttons, I don't know if he's here today, but we had Kittitas County Sheriff's Office, Nisqually, Commander Jeff, Nisqually Corrections, they were our first tribal jail to join. And those facilities, those 8 facilities launched on July 1 of 2025. Then we had a cohort 1B. Those facilities that launched on November 1 of 2025 include Grays Harbor County. We had Linwood Jail, we had Puyallup City Jail, and Whatcom County Juvenile Detention. So right now we have 12 facilities that are live that went into cohort number 1. So I don't know if they're there, but I think that deserves a round of applause. A big heavy lift in getting those facilities up and running, but they have been moving so far. Let's go to the next slide. Now we're in cohort 2, and I think I'm going to ask our facilitator here for protocol. Do we answer questions now, or do you want to wait to after this over? I just want to make sure I'm in established protocol, Tony.
You know, Tyron, whatever works for you. You know, I think, well, I guess actually typically we do wait until the very end. That's right. Never mind. I say that and I take it back. So yes, let's hold all questions until the end.
Okay, great.
That way Blake can take us through facilitating question and answer.
All right, great. Thank you. And so right now, the next group that we have that launched cohort 2, where we're at now, we have the South Correctional Entity, or SCORE, so we may know them as, and Walla Walla Juvenile. They went live January 1 of 2026. So I want to give them a clap as well. So all facilities, once they go live, we have them participate in what we have here is a rapid response meeting with all of our subject matter experts from eligibility, pharmacy, provider enrollment, Provider One, our MCOs are there, DBHR is represented, WASPIC, or our Washington Association of Sheriffs and Police Chiefs, are there. And really, we're just checking systems to ensure facilities have what they need. There are no major system problems. And so those calls occur about 4 to 6 weeks. Then we have them join our office hours with our third-party administrator. I'm going to talk about a little bit later, but that's our TPA. And the TPA is really an entity that's providing technical assistance and claims clearinghouse assistance to facilities as needed. And so that's where we are with those facilities. It's still more good news. So let's move over to the next slide, because we are now at cohort 2B. We had 6 facilities that launched yesterday, and I'm really, really excited about that because DCYF has 2 facilities that joined. Echo Glen and Green Hill went live yesterday. And so they are our first state institution to join, and I think that's worth a round of applause too, because there's been some work there. DCYF, I don't know if they're on the line, but that was a lot of work there. Great job getting across the finish line. But to finish out, those that launched yesterday, also want to give them a round of applause as well. We had Franklin County, Grant County went, Yakima County, and Pacific counties went live yesterday. So I don't know if they're on this call, but I will say let's give them a hand as well. A lot of great work there, getting them ready to launch and moving forward with this reentry initiative. So that's cohort 2B. So where are we moving into? Because the program has met another milestone. And if we pivot over to the next slide, we now come to cohort number 3 and our partners at the Department of Corrections. Department of Corrections, we've been working with them as well. So our partners from DOC are on track. They are planning to launch all 10 of their facilities on July 1, which include Coyote Ridge, Clallam Bay. They have Washington Correction Center for Women, Olympic Correction Center. We got Cedar Creek. We got Stafford Creek, Monroe, Airway Heights, Washington State Penitentiary, and Washington Correction Center. All are going to be releasing July 1. So woohoo there. I don't know if Lou is on, but or the team there in this meeting. But hey, great work that's happening there. So as I round out cohort 3, if we go to the next slide, we have an additional 15 facilities that are going to be joining DOC launching July 1. That includes Aberdeen City Jail. We got Benton County Corrections, Benton Franklin County Juvenile, Cowlitz County Jail, DCYF. They have one more facility that they're going to be launching, Harbor Heights, going live on July 1, 2026. And then there's Hoquiam City. There's King County. King County's in the house, if I could say that. King County's Corrections. They have the Mailing Regional Justice Center. King County Judge Patricia H. Clark facility is joining. There's Okanagan Juvenile Detention. Okanagan County Sheriff Department is joining. We have Skagit County, Spokane County Detention. We have Spokane facility, Geiger Corrections, Stevens County, Whatcom County. And on this list here, I have to point out Yakima County joined yesterday. So my apologies there. When Yakima had an issue we had to clear up last week. So they were looking at going to July 1, but we got that issue cleared. And so they launched yesterday. And so we just didn't have enough time to make that correction here, but we'll make sure that we get that for you. And so far the facilities what that you see here have done a tremendous amount of work, as Tony mentioned earlier, to get going live here. A lot of work that has happened. And so all of those facilities that you've seen have elected to participate in the reentry. And so as we move to the next few slides, there are some facilities that are not participating in the reentry initiative. And if we go to the next one, the next slide, I want to say go up one more because we have 2 of the non-participating. You see the facilities there. You see Aberdeen is there. You see Adams, Soton, Chelan. Clark is to be added to this one here. Clark will not be able to participate. And so we got Chelan, Columbia, Enumclaw. We got Ferry County, Forks, Garfield County, Island County, Issaquah, Jefferson County, Kent Police Department, Clickitat, and Lewis County. And so again, Yakima, let's go to the next slide. You'll see Yakima on this slide. We moved them over, so Yakima should be removed. But here are the remaining non-participating facilities. Lincoln, Marysville, we have Mason County, Oak Harbor, Ponderay County, Pierce County, San Juan, Scomadia, Snohomish, Sunnyside, Thurston County, Whitman County, and again, Yakima should be removed from this list. But overall, our outreach to these facilities, and then we had a survey that went out to these facilities, and we really were just trying to get some information as to, is there any barriers? The reason why you're not participating? Is there anything that the healthcare authority can do to help? How can we help? Bring this reentry initiative to your county, make it a reality. And so just some of the feedback that we've been getting to some of them, the reason why many of the facilities are up on that list that are not participating is that they cited the reentry initiative. They just didn't have they had limited resources, really limited internal resources that they couldn't participate. There was because the county had other high level activities that were taking priority. They just could not. They just really couldn't participate, and so that is the list. And so that leads us to the other part of the carceral facilities out there. You've heard about some of the juvenile detention, you heard about our juvenile rehabilitation, but I want to share with you the juvenile detention facilities. If you go to the next slide, what's important here is that the Consolidated Appropriations Act is around eligible juveniles who are listed under the age of 21 or 18 and 26 that are under the former foster care eligibility group. So this impacts those eligible children or kids, I should say, excuse me, that are incarcerated in a public institution. Of course, that would be our jails, juvenile detention, the juvenile rehab, prisons, etc. And so Section 5121 is mandatory that the states provide the screening, that diagnostic and targeted case management services to eligible juveniles in 30 days before their release from a detention facility. And so while the provisions of the CAA became effective January 1 of 2025. And so we implemented the CAA 5121 requirements alongside our reentry project. And so the slide that you see there reflects facilities that are in compliance or meeting the requirements of CAA. Those that are highlighted, we're just doing our due diligence here. We've been checking on facilities, of course, outreaching just to see how things are going, but we have not heard back from those that are highlighted. We haven't heard back from College as yet, Grace Harbor County Juvenile. We haven't heard back from Island County. We haven't heard back from Martin Hall. And then if you go to the next slide, you see those that are meeting the requirements. We have one more, Yakima County Juvenile Justice Center. So those facilities are meeting the requirements. We just need to follow up with those 5. We reached out to them, but we haven't heard back from them to ensure that this is moving forward and they are getting the things that they need in order to make that a reality. Let's pivot over to the next slide. So on the horizon, and you can go one more slide, thank you. Overall, our approach has been engaging with the implementation partners such as WASPIC, or Washington Association of Sheriffs and Police Chiefs, correctional facilities, managed care organizations, our accountable communities of health and providers, state agencies like DOC, DCYF, DBHR here at the Healthcare Authority, and our reentry advisory work group. If it had not been for those individuals that I mentioned there, even to start to, I don't know if I just met Dr. Caleb a couple of weeks ago. We have Mark Stern, Rick Bishop. There are so many names I can call out there, but these individuals have been monumental in helping us launch this. It has definitely been a team effort. And so other states are calling to Washington State. And, you know, the question is, how did you guys do it? What are you doing? And we always reference our partnership, the teamwork that we have amongst the group, especially with our reentry advisory work group, helping us along the way. That has been instrumental. And so I always tell them, if you don't have something like that set up, get that set up, because it's going to be beneficial to you in the long run. But when it comes down to the resources, just to recap, we launched a capacity building program that required facilities to describe, again, their existing capabilities. We put into motion that readiness assessment that requires facilities to demonstrate their ability. But also we conducted learning webinar series, and these webinars covered key topics and provided valuable insight for fulfilling the requirements of the initiative. Our learning series included sessions on contracting and credentialing, provider enrollment, eligibility, benefits, and these are online for facilities to review. We published our policy and operations guide, and it's a comprehensive written manual that outlines the various program requirements. We have weekly hours on Wednesdays for facilities. They're meeting with our TPA. And again, we have those rapid response calls. In fact, one is going on right now with the facilities that launched yesterday, and they're meeting with our subject matter experts. They're meeting right now with the MCOs and some of our WASPIC members. And then the TPA. The TPA is a third-party administrator, and they are Community Health Partners Services, CHPS, a division of CHPW, one of our MCOs. And so they're here to provide technical assistance and billing and claims payment clearinghouse services for facilities. Also, the TPA holds learning series as well to ensure facilities have what they mean. So a tremendous amount of work. And so if we go to the next slide, one of our goals here is to reduce recidivism. And we have done some site visits, and we've been really just outreaching to the facilities. And I'm just really, really happy to say we were at Nisqually last month, and they were sharing about their success, about people who have been in and out of the jail. But once the services started over there, they haven't seen those individuals since. And I was like, wow, the constant repeaters that, we're going through, that's a really, really good sign. This is working. KidSAP, I don't know if again, if Commander Sap has so much appreciation for the work that she's doing over there with her team in KidSAP. They alerted us a couple of weeks ago that they have 5 people who were able to get medication for hepatitis C. Did you hear that? That they were able to get medication for hepatitis C. So that's a really big deal up there. And so the other facilities are telling us stories about how they're building new partnerships with community-based organizations, how they're analyzing behavioral health data and identifying key health disparity gaps. That's the first. How they're prioritizing MOUD or MAUD treatment, that's been great to hear. How they're adjusting really just their internal coordination to reduce delays and improve engagement at release. That's really exciting. And really, the big thing is what we're hearing from the facilities is that how they're centering and incorporating lived experience into decisions and services of those coordinated efforts. So all of that is really, really great work out there that is happening. And as we turn to the next slide, I want to point out something. Has it been smooth sailing, Tyron? I can say no, because I wouldn't be transparent. I wouldn't be authentic if I said that. However, we have to remember we're working where systems are transitioning. You have Medicaid system and you have the public safety system, 2 whole different worlds that are working and talking together. That has never been the case. And so we're at the foreground of this emergence, if you would, and we're really, really happy about that nationwide. But along with the good and possible, there are some challenges. For example, facilities have had providers who they were working with at first, and then the provider is no longer working with them. Contracts were ended. And now some of our facilities had to scramble to run and find other providers to contract with. That has been one of the hurdles. Pharmacy could be putting that same thing. You got technical systems that are working, making sure that electronic health records are lined up. So all of that work is going on. Facilities. Understanding the contractual process. What does it mean to contract with a managed care organization? Who are the managed care organization? What is it that they do? And so that's been a learning curve. Some facilities, we found out, ran into firewall issues where the MCOs were not receiving care plans. And we were going on and it's like, what's going on? Oh, guess what? It's a firewall issue. We want to make sure that all attachments are able to get through, and we want to make sure that information is HIPAA compliant and private and confidential. And so all of those things, some workarounds that had to be there. And I would say last but not least, facilities understanding what it takes to submit a claim and bill. All of that is brand new, especially all of the billing codes that are out there. So we hear it loud and clear, working with facilities to make sure that the billing is correct and they can get those in. Our TPA is working with them as well. So I'm going to say, let's go to the next slide, Blake. So in closing, I always like to close and say, hey, there are 2 stories. One is about the science of policing, which is public safety, right? Then you got the housing, healthcare, livable wage jobs that, being soft on crime and all those kind of things. And so the science is really to create public safety for Washingtonians. And basically it's been about reducing the recidivism. The second story is about those with the lived experience and how the program is helping them get what they need for themselves to make them make that life change for them and their families. But another population, like I said, the lived experience, what is it that they're receiving from this? And like I said, the stories that they come in from the hepatitis C facilities, not seeing those repeaters that come in and out of the facility, that lets me know that we're doing something right here for Washington, and really as a I would say, if I could say, a poster child, but really a beacon of light for the nation as to the work that we're doing up here. And so I believe I met my time, Tony. I hope I didn't go over. If I did, I apologize, because I get really excited about this stuff here. So I think this would be a good time to take on some questions. If I'm still in protocol, is this the time to take on questions?
Yes, and we have one
Okay.
for you.
All right, go ahead.
All right. We see here real quick. Addie, excuse me. please.
Hi, thank you so much for that presentation and for sharing all the wonderful work you're doing. It was really great to hear about. And I know nobody has like a crystal ball about this stuff, but I'm wondering if there's an understanding of how the Medicaid changes that are coming related to the One Big Beautiful Bill would interrupt this work, and if the HCA is doing anything to get in front of that in terms of asking for this population of people to be an exception to some of these burdensome requirements.
So I'm going to say yes, yes, and yes. So we have a team that's already working on that. Also, it's a little early to tell some of the numbers and what the data will provide, as we report out to CMS. But yes, work is on the ongoing to really make sure that we're meeting the requirements of the Big Beautiful Bill or HR1 for facilities. And so what I'm hearing from around the nation, there has been, I would say, partisan support in order to keep this program around the nation going. We haven't heard anything otherwise, but for the Big Beautiful Bill, yes, we have been doing work around that. And I believe
Thank you
it
so
was
much.
that Addie? Was that Addie?
Yeah.
Okay, yes, perfect. Thank you. I just want to make sure I pronounced your name right. Got what you
Yeah.
needed. Thanks.
Thank you so much. Yeah.
Yes.
Any other questions for Tyron? Malika.
Thank you, Tyron, for the presentation. I'm curious, so a trend that I've been hearing about across the state is that a lot of jails are moving to like pretty much strictly telemedicine providers. And um, just curious how that is going to be able to provide the level of care that a lot of folks actually need. And wondering how that intersects with this waiver and understanding that there would obviously be payment for care, but like it's not uh the ability for the level of care that folks need isn't able to be met by that sort of system.
Well, so for the waiver, so matter of fact, if we go back to that earlier slide, facilities do need to meet those requirements. That's mandatory for the program. We have requirements also for making sure that those warm handoff and care plans happen. And so I know some facilities are doing a mixture of that. Haven't seen the numbers, but I'm glad you mentioned that as to how many of them are going or doing telework. One of the things we had with our capacity building application funds was that facilities can get the information that they need there. And so I'm going to say some of them bought equipment, not information, but equipment that they needed around telehealth or whatever that they needed in order to do the program. But I want to say for the program overall, yes, thank you, Blake. Facilities have to do this work here, the reentry targeted case management, and they have to abide by and make sure that they're doing this work here for the initiative. So thanks a lot for that question, and let me do some digging here as well because I think it's a good question. Who has gone to telework? Not telework, telemedicine? How impactful is it? And I think we would want to get out in front of that and get some more information. But excellent question there.
Because I know that at least three of the facilities that you mentioned earlier have made this switch, and fairly recently. And I am, and I don't say this because like from a judgment place of like I want to be right, and they're like I want people to have what they need for care. It does not seem like it was a financial decision. It's not an improvement of care decision. And a lot of them have been working this process with you for quite some time, but they have made the move completely to telemedicine. And as things are right now, that I know of in those communities, they are not going to have the capacity to actually be able to provide the care.
Hey, but thanks a lot for that, Malika.
Okay,
Good
all
question.
right.
Let me do some follow up on there. You said at least three facilities, so yeah, let me dig
That you
into that. Thank
mentioned.
you.
Okay, thanks.
Okay, perfect. Thank you.
Okay, any more questions for Tyron? All right, Tyron, thank you so much for
Yeah,
your
absolutely.
presentation. We tell you're excited. Nice work. Keep it going.
Hey, thank you.
Yeah. All right, Tony, I want to introduce our next guests, Robin and Chris.
Yeah, thanks so much. And thanks again, Tyron, for being here and all the great information. If there's a general mailbox or inbox that people could contact with follow-up questions, should we direct those to you, or I don't know if there's one you can put in the chat just so we have that for the notes. That'd be helpful.
Yeah, definitely. I'll put it into the chat.
Awesome. Thanks again. And thanks, Monica, as well, for being here. I saw you joined, and completely understand you being late. Those reentry go live calls, I know there's a lot of work happening there. Okay,
Thank you so much, Tony.
Yeah, absolutely. Our next presentation slated is the Blake Implementation and Administrative Office of the Courts, and I think we're going to focus on the refund efforts to get individuals refunded their LFOs and other stuff that's happening. And thank you again so much for being here in person. Yeah, it's great to meet you, and appreciate your time today. Sorry we're a little behind schedule, and so hopefully that doesn't impact you, but I will pass it off to Robin and Chris.
All right, thanks, Tony. Again, Christopher Stanley, I'm the Chief Financial and Management Officer at the Administrative Office of the Courts and responsible for the Blake Refund Bureau in my division. With me is Robin Zimmerman, our Blake External Relations Liaison, who's been doing all the heavy lifting out in the field to help promote our efforts in vacating and refunding affected individuals. If we go to the next slide, please, start with a little bit of history. In 2021, the Washington State Supreme Court found that the law criminalizing drug possession was unconstitutional. It lacked a mens rea component, which means that if people didn't know they were committing a crime, then the crime was not crime. So they, in their decision, they took it all the way back to the passage of the law in 1971. So effectively 50 years of drug possession convictions were thrown out and reversed. What that practically means is, if we go to the next slide, 600,000 cases have to go before the courts in their various jurisdictions, well over, I believe, 150 jurisdictions, and be vacated. It's not the same as a dismissal. A vacate wipes someone's record to an extent that the issue never occurred. It changes history. Doesn't change memory, right? Because people still experience what they experienced, but it wipes it off their record as though it never happened. So there's over 350,000 people impacted by these convictions. Of course, those of us that are millennials lived through the drug wars of the 80s and 90s, so we all know that these convictions were very active, especially during my childhood. So we have 600,000 of these to go through. Right now, we've given back about $10 million in refunds to over 6,000 cases. These refunds span anywhere from $800 to $18,000. In one instance, there was an individual who received over $9,000, and it's crazy. Their original fine was, I believe, $3,000 to $4,000, but because of collections costs and interest, they ended up paying over $9,000. So this guy got his money back, thankfully. There's lots more out there. There's $31 million still available to claim. We've got 100,000 cases in the Blake Refund Bureau list. You can search for your name. If you're an affected individual, 100,000 cases to go through and see if you have any money there. We're to the point where we're going to start cold calling people or sending emails saying, hey, is the administrative office of the courts. You might have some money sitting in this account. We're not as effective as the claim your cash efforts at Department of Revenue. We don't have that kind of budget, but hopefully we can reach out to folks effectively. Let's check out our progress with the next slide. So how are we doing? Well, in Superior Courts, we've got 140,000 left to go. About 240,000 in Superior Courts. We've cleared 101,000 right now. You see in District Courts, there's a lot of work to go. We've cleared, what's that, about 9,000 cases and about 44,000 to go. And then in munis, we're about halfway done. About 14,000 cases left in the municipal courts. You might ask yourself, how's a municipal court affected by a felony drug statute, since municipal courts don't hear felonies? Well, a lot of municipalities tie their city ordinances to RCWs. And in many instances, municipalities tied their drug possession ordinance to the felony statute that was deemed unconstitutional. And so when you throw that out, you toss the ordinance as well. So we've got a lot more work to do, I believe. I came into this job back in July 2001, a couple of months after we'd already started, and we were just starting to negotiate with counties and cities about how much money it would take and how and where the money would go. We've got tens of millions of dollars available to assist cities and counties with the costs of doing this work. It's 100% free. The state is paying 100% of the costs, right down to a copier in Benton County. We have funding available and ready to be distributed to do this work, and really need everyone to be claiming it. So again, I came into this in 2001. I testified at the legislature later that year, in early 2022, that this was a 6 to 10 year project. Here we are in 2026. So we have 5 to 6 years left to go in the project. And as you can see, a lot of work remaining. I want to turn it over to Robin at this point to talk about our outreach efforts and how we're reaching folks that are Blake affected and don't know about the relief that's available to them.
Thanks, Chris. Hi, everybody. Thanks for having us. Actually, next slide, please. Yeah, so to touch upon some of the data that Chris presented, this impacts over 350,000 individuals. And this is over 50 years. This is 50 years of convictions. And so 1971 to 2021. And I mean, yes, the conviction had to be in Washington State to be to receive Blake relief. However, people move around of 50 years, right? And so how do we find these individuals? And so my role is in leading the outreach, but I also want to say, just to kind of drive this home, that I'm the sole person that has been hired to do outreach in Washington courts for administrative courts for 330,000 individuals, and getting the word out, right? And budget is, I mean, there's some budget cuts. I do work hand in hand, as you can see on this slide. I work with Washington State Office of Public Defense. I work with courts, legal aid groups such as Living with Conviction, Civil Survival, Way to Justice, Spokane, Office of Civil Legal Aid, Department of Corrections. Have been absolutely instrumental in getting the word out, but there's so much more to be done and to find these individuals. I work with reentry empowerment groups. I mean, Tyron Nixon, hey, hit me up if we can collaborate. So I'm looking for help. It's beyond myself, other groups. I mean, as many people as possible, right? And people digest media and information different ways. Go to the next slide, please. And it kind of brings me to, so I did a lot of work in Aberdeen, the More Right group. It's a recovery center, and Sasha Buell, she is a certified peer counselor there. Just give a moment for this was her kind of just takeaways from when we started getting involved and promoting Blake outreach, Blake relief in our outreach efforts. And when I was there, speaking of how to reach individuals, right? And yes, we can saturate social media. We can hit all different online and bus wraps channels we possibly can. But there's a lot of individuals that might not be able to have access to any of that. And there was one person there at the More Right group that I talked to that he, for the encampment in Aberdeen, he was formerly, as he called, he was named, and he was the mayor of Tent City. And he worked with me when I was there doing like outreach and relief, got on his phone, reached his network of individuals that knew people that didn't have access to phones. We were flooded with it. Like he just spent 2 hours on his phone. Then and we just all of a sudden just this, so many individuals that definitely had these convictions to get vacated, cleared up your criminal record, to get refunds. It's beyond just the refund. It's the vacation, the opportunities for like housing and that was just that was so impactful to me because again, we can have various groups working, but that word of mouth. And I know that this is also open to the public, and so I also call on the public to help get this information out because this really does change lives. This really impacts individuals, and how many layers of the onion? Like a single mother has a conviction, right, and then she is indebted with like having to pay these legal financial obligations over and over. If she can't pay them, it goes to collections. All of a sudden, she has to choose between paying her LFO or feeding her children, and can end up back in the system again. And so it's so important. And so, please, next slide. So Sasha, the same individual that just was talking about her experience as a certified peer counselor, I just got an email from her last week. I'll let you read this. So she's a Blake impacted individual who was there, and it's amazing what this opportunity can do. This potential relief. It's really powerful, and I'm of course highly passionate about this, and I would absolutely love anyone to reach out to me. My contact information to get into this and find ways because it's going to take a collective effort to really be able to get this relief to those that are impacted.
So, go ahead.
And so we just put out a PSA, TVW, thank you TVW, this together for us, and donated this to us. So this is part of it. Basically, there's different steps. So we're the refund bureau, right, at AOC. We house the refund bureau, which is a centralized refund facilitator. But first, you need to get your conviction vacated first. And that starts, so we're kind of the last step. The conviction vacation starts with like Office of Public Defense or legal aid groups, such as like Living with Convictions, Civil Survival, Way to Justice, right? So that email below, that's on Washington State Office of Public Defense. So for those that are impacted or know someone that might be, so you can find out if you're eligible by reaching out to Office of Public Defense, and then they help you through the process, get order clearing your conviction, and then once that happens, then you can see if you have any court or fines or fees that you paid in connection with that conviction. You were paid through our refund bureau. However, there are most jurisdictions require an individual to come forward and see if they qualify for this relief. But there are some jurisdictions that have done ex parte vacates, which means that they just basically went through and saw all the convictions and they vacated them already. King County did a lot of that, and so then you can also just go to the Blake Refund Bureau website, and we have a portal. You can enter your name in, so you can just start there because maybe your conviction already has been vacated. You can search to see if there's already a refund attached. If it has been vacated, the refund should be uploaded and attached. But I'd say for the majority, you're going to definitely have to probably go through the steps to come forward. And again, that's why it's important to find these individuals, because people don't know that they have this, right? Or even they might not even know if their conviction's been vacated. So, yeah, it might already be there. I turn back to Chris.
So on that note, the work is far from complete. We can go to the next slide. Early on, we put a significant focus on resentencing, in part to avert, as best as possible, a massive travesty of justice, where someone might have been sitting in jail or prison, and because of the vacate of their drug conviction, should no longer have been in a facility. So we put all of our efforts on resentencing individuals who were currently incarcerated first, and then we moved on to the other resentencing cases. So I don't know if anyone here has ever gotten a speeding ticket or even a parking violation. Almost no one looks at their RCW. That's on the violation. Like, they're supposed to cite you with some violation of the law, and they're supposed to write it on the ticket. No one looks at that. So part of the difficulty in identifying, in getting the word out and identifying these individuals is they might remember they have a drug conviction, but they don't know. They didn't memorize the RCW they were charged with or convicted of. So part of our effort is just saying, hey, were you ever convicted of anything related to drugs? Check your name, LPD. Check your name on the Blake Refund Bureau. So we're really, trying to make an effort around that. A lot of the work has slowed to a trickle as far as new Blake motions, but again, we're now in the stage of making a concerted effort of finding individuals to come forward. We can go to the next slide. So all this costs money. We received $118 million 4 years ago to do this work. And over time, it has been spent down. Also, due to the state budget crisis, a lot of those funds have been spent, appropriated by the legislature for other purposes. So the funding is diminishing, and we will probably be looking for another infusion of general fund state to this account in the next biennial budget request for the 27-29 biennium. The Office of Civil Legal Aid that funds legal aid groups saw a $5 million cut to their budget, and they had to stop their Blake work last June. So we are, always on a knife's edge related to funding, as many programs are in this space. But we're under a court order. So it doesn't matter to me if we run out of money to pay refunds. If you claim your refund, the state is obligated to pay you. So if we run out, we're going to keep cutting checks, and we're going to ask the legislature for a reimbursement, because it's compliance with the court order that matters. So that's our primary goal. So that's where we're at on the Blake implementation. Again, the work continues. Robin and I and the folks back at the Blake Refund Bureau and the Blake Vacate Unit are extraordinarily busy and happy to take your questions on our efforts. Oh, and my email address should be Christopher.Stanley.
Oh, sorry. That's
so, if you send it to that email address, it won't
yes,
get
okay, Christopher.Stanley.
That's the email address we use for complaints.
All right. Questions for Robin and Chris.
I have a quick question. Given the reduced budget and the amount of administrative work that it takes to process those vacations at the individual jurisdiction level, why aren't more jurisdictions doing what King County did and just doing a blanket vacation of all those charges?
So it's complicated. There's a difference of opinion on whether or not ex parte hearings are allowable. We believe they are, but each court is different, and so each court is doing it differently. In a lot of instances, so we've set up what we call a Blake vacate unit, 2 attorneys at the administrative office of the courts that actually prep all the paperwork that a judge needs. And when the individual comes forward, all the paperwork is already ready to go. Well, nothing else has to happen. The person just has to show up and request it. So we've been doing a lot of the administrative work for courts in order to speed things along for those courts that don't want to do ex parte orders. And it's totally fine. It's their call. It's their court. We're a non-unified court system. So that's the short answer.
Thank you both so much for bringing this information to the group. We figured with the amount of providers, direct service providers that attend these meetings, behavioral health agencies, committee members, that it was a great opportunity to make sure that we were sharing about how to help get individuals that were serving in the community in contact with the resources to vacate their convictions as well as get refunds for that money that they spent. What is like, if I'm a service provider in the community, I'm working with somebody and we're doing, going over goals and stuff like that, like what's the best way to what's the most low barrier approach to that to get that person in contact with the right person? Like, is there a single point of contact, or do we tell individuals that could be impacted by this to go to, what was it, opd.wa.gov or?
Yeah, as far as, well, like I said, you can check just through the refund bureau, courts.wa.gov/Blake refund. You can check on the portal to see if your name is there, like if there's a refund attached, which means it's been vacated. But OPD definitely is the go-to. But as far as getting the word out too, yeah, please reach out to me.
Okay, great. And then we'll add those to the notes. We'll get that website, the courts.wa.gov.
Yeah, and it's actually on this postcard. And also,
yeah, tell everyone about those.
Yeah, so we have a lot of informational collateral that I would absolutely love to get in it, raise hands, and please disseminate this information. And I also work to custom tailor communications. I have a social media toolkit. I've helped launch relief days, events where we custom tailor to the jurisdiction or a certain area. And so if a particular organization wants to get the word out, we can have a conversation and figure out how they want to approach it and their networks and their audience, and figure out the best way and we can create a lot of different information like posters, Eventbrites, things like that. Awesome. Yeah, and postcards.
Cool. Well, thanks so much.
Thank you.
Yeah, great information.
Thanks for having us. Thank you. Thank you all. Appreciate it.
Any questions? Any more questions? I saw I had flash there. Okay, maybe not.
It looks like there is a quick question. How would an agency or organization go about getting these printed flyers?
Reach out to me.
So
yeah, I mean, I'll either mail them or I'll drive them up or I'll come in person. Yeah, I mean, I've been traveling all over the state doing this work, and I have a plethora of these, and we'll keep printing them. And this is charged to ourselves, not to you at all. So yes.
Great. Well, thank you so much. All right. Let's pull up the agenda.
Go ahead, Tony. Go ahead.
Yeah, no, I'm sorry. I was just thinking the agenda is going to help me.
Next up is Chloe with the SURS plan update.
Awesome. Okay. Thanks again to our guests, Robin and Chris, and thanks for all the work that you do. Next we have up for our agenda is a presentation by Chloe Wilkins, also within the Healthcare Authority Division of Behavioral Health and Recovery, in a different section of work than the prenatal through 25 section. And Chloe has been supporting what was originally a SURS plan recommendation, and there was efforts, I think, a little preceding that, around training for caregivers of youth with substance use disorder. So Chloe put together some slides, and Chloe, I should have checked before I started rambling here. Chloe, are you here?
I'm here as long as you can hear me.
We can hear you great. And
Awesome.
sorry for being 5 minutes behind schedule. Appreciate your patience with that. And I will hand it over to you to tell us about all the work that you've been doing with our partners.
Okay, thank you, Tony. Just like a real quick slide check. You can see my screen.
Yes, we can.
Okay. I'm also going to just drop a few links in the chat. As I go along, there may be some touch points for folks who maybe aren't familiar with kind of some of the background here. But good morning, everyone. Tony, thanks for the introduction. Chloe Wilkins, she, her, I work at HCA in the Division of Behavioral Health and Recovery in the prenatal to 25 behavioral health section. And my focus is really on youth and young adult substance use disorder services. And my hope here is to provide an update on the Substance Use Recovery Services Plan regarding the SURSAC Recommendation 4. And again, some of these links are in the chat if you want to look up what that all means. I'll talk a little bit more. So if some of you were here in June 2024, I provided a previous update on SURSAC Recommendation 4, which includes language to provide and enhance SUD training for caregivers. And since then, there has been additional work done to support family members who love someone with a substance use disorder. And I'd consider now several different work streams that could be considered under the umbrella of SUD family system education. And I'd like to start first just with the updates of the work that's historically been tied to the SURSAC Recommendation 4 and then how it's expanded. And really the language that directed this work under 5536 Section 20. And again, both those links are in the chat. So where are we today? As previously mentioned, the SURSAC Recommendation 4 supported 5536 Section 20 language that directed HCA to create a training program for parents of adolescents and transition age youth with substance use disorders by June 2024. And beginning in March of 2021, HCA partnered with Washington State Community Connectors and En Route to provide 12 16-hour trainings throughout the contracted year. These trainings were advertised for parents and family members by parents and family members, really emphasizing the importance of peer work within our family systems. In January 2024, work began to include additional modules to this training to address the requirements in Substitute Senate Bill 5536, including additional topics related to foster-involved youth and their families and caretakers, suicide prevention, naloxone information, and medications for opioid use disorder. And after feedback from the update in June 2024 that I brought to SURSAC, both from SURSAC and other community members, that the 16-hour midday training was just not feasible for many to attend. So a new format for this training was developed in early 2025 to include 8 two-hour modules held on multiple days throughout the week in both morning and evening hours. And in addition to these scheduling updates, which has seemed to have a real positive impact on individuals being able to attend this training, modules now include community reinforcement and family training skills, which is an evidence-based practice to support family members who love somebody with a substance use disorder. And just to highlight here that CRAF was specifically referenced in the SURSAC Recommendation 4 as an evidence-based practice that should be considered as a support service to families. So just kind of another look, another way to see how these updates have been provided. And a version of this training can also be accessed outside the scheduled training times through an online self-paced version at sudwashington.com, and that's contracted through En Route. So moving forward with what's new since June 2024, In addition to the updates to the SUD family education sessions, as referenced, community reinforcement and family training, also known as CRAFT, was a specific evidence-based practice that was highlighted in SURSAC recommendation 4. And to better support this recommendation, there have been several work streams to expand these services across the state. And again, for the sake of time, if you want to do a deep dive on CRAFT and kind of what that means, there's a link in the chat. Really encourage you to look at that as well. In early 2025, there was a series of webinars tailored to behavioral health providers with the objective to educate providers on really what is CRAFT and why they might be interested in providing that modality. And really a hope here was just to gauge interest on further training. There were 5 webinars in total with 56 participants, and surveys showed strong interest in more in-depth training on the topic. Taking this feedback, HCA provided 2 in-person CRAFT facilitator trainings, which consisted of 16 hours of training over the course of 2 days, where providers are trained on how to deliver CRAFT in a group setting to family members. And along with this training, organizations were provided a 10-week curriculum to provide these groups. And then along with a implementation training call, a monthly training call that they could attend with our CRAFT certified training, really to support implementation, walk through any barriers, and just get that ongoing support to make sure these groups felt supportive to their communities. A little bit about the cohorts that have gone through the training. Our first cohort was trained in May 2025, and participants attending came from 2 of our SUD Family Navigator sites, along with Washington State Community Connectors, who I talked about earlier, really to support bringing those skills into the SUD family education training. The second training was conducted in November 2025, and it included 2 youth OP providers, along with other SUD outpatient agencies. We have 2 more facilitator trainings that have been scheduled, one in June of this year for our youth residential providers who are contracted with our MCOs, and a second training in which providers have yet to be identified, but our hope is to outreach folks more in rural counties to make sure we can expand these services in an equitable way. Organizations that attend these trainings sign an attestation agreeing to provide at least 1 CRAFT group a week for a minimum of 12 months, and then the distribution of surveys in effort to collect information on the effectiveness of these groups and really the impact it's making on our families' lives. So just a quick look at some of our partnership and reach. These trainings are advertised through Washington State Community Connectors Provider Network and Community Network, Gov Delivery Messaging, the Athena Forum, and in collaboration with DCYF, have been shared through multiple channels, including but not limited to juvenile rehabilitation, extended foster care, their SUD program regional leads, and their child welfare provider network. So I'll pause there. I just really thank you all for letting me take the time to do a huge info dump on the work that's being done around the state right now to support our families impacted by SUD. And just really appreciate everybody's time this morning. Thanks for letting me share.
All right, questions for Chloe? Addie.
Hi, this isn't a question. This is a shout out and appreciation for Chloe and the work of her and her team. I run an adolescent learning collaborative, and multiple behavioral health providers who attend this have benefited from the work that Chloe has just described. So I just want to say the impact that this work is having is real, and people are so grateful for this resource, and I am grateful for it as well. Thanks, Chloe.
Thank you, Addie. I really appreciate that.
All right, any other questions or comments for Chloe? All right, thank you, Chloe.
And thank you,
Appreciate
Blake.
your time and the information. All right. Tony. Next up, I believe. We have
Yeah, sorry.
Sean.
Sorry.
No worries.
Oh, yeah, I was making a note. Chloe, thank you so much. What a great, helpful summary and presentation. I appreciate you putting all the links in the chat. And we'll continue just kind of flagging for the next several meetings of the year. We'll try to bring somebody each month to focus on like a specific recommendation that was in the SURS plan, just so that we can continue to have opportunity to get updates on those recommendations. And then we're also, if you recall, last month, Michelle shared a really helpful in-depth document that breaks down each recommendation by sub-recommendation, and then it has kind of like a table which indicates to what extent it's been implemented or if it's still lacking some sort of legislative authority or funding. And that's on our SharePoint. And so just a reminder for the committee members that that's there, and we can always bring that back as well and go through that within this meeting in more depth and take questions and take comments if that would be helpful. So be thinking about that as we continue to try to kind of provide up-to-date information on efforts related to the Substance Use Recovery Services Plan, now that it's been 4 years since that plan was released. Okay, so we have our next agenda item. Sean O'Neill here from our Legislative Affairs Office within the Healthcare Authority has agreed to spend the last 30 minutes in the meeting with us talking about the legislative session, talking about some of the bills, policy bills, fiscal bills that might be making their way through the legislature. As a reminder, March 12th is the last day of session, and so it's just right around the corner. And then we're also going to share a summary of some of the supplemental budget proposals that came out of the House and Senate that I'm sure a lot of you have been tracking. And so let's go ahead and get that update and conversation started. We wanted to make sure there is enough time, so I'm glad that we have about a half hour because this is really important. Important to be aware of these proposed changes, and so wanted to make sure that everyone had this information and definitely make sure there's enough time for questions and comments about those proposed changes in the budget. Sean, are you here? If you are here and you're talking, you're on mute. And
Yes.
yeah, I see your microphone, like in the Teams thing, the microphone's not muted, but I can't hear you.
You're not calling on me, are you, Tony? I just joined. Sorry.
Yes, I'm sorry. We were a little ahead of schedule, so my apologies on that. Sean, I was, but this is perfect timing. You're
Okay.
here.
I was thinking, okay, no one's talking. No one's saying anything. That's probably they're saying Sean, and I didn't hear it. Okay.
Sean,
What?
Sean, thanks for being here. If you want to introduce yourself, and then
Absolutely.
Really appreciate your time today.
Sure thing. Always happy to join. So, for the record, my name is Sean O'Neill, and I'm the Legislative Relations Manager at the Washington State Healthcare Authority. That is, I guess, what I say when I testify, which this isn't actually testimony, but I didn't sleep very well last night, so I'm a little punchy. So here to give a little overview of the state of the legislature right now. And so where we are at day 50 of a 60-day legislative session. So, that would be 5/6 of the way done. So what is that, 75%, I think. I don't know if my quick math is very good, but someone can correct me if I'm wrong. And so 80% actually, now that I think about that. it is the time for all, it is a cutoff day today, and that means that all fiscal bills have to be out of the opposite house and onto the floor by 5 o'clock today. So I think that there's going to be some executive sessions in the fiscal committees this morning, and then the legislature will just be on the floor passing bills out of the opposite house, doing concurrences, and also doing conferences, and just working out the final details of everything, of which the big enchilada in that process is the budget. So the House did pass the Senate budget out of the House over the weekend, and they amended it to include the House budget. And so that it will go to conference now, and the two chairs will be hammering out the details on the budgets. A couple of top line notes on that. I have never in my 17 years of being in the legislature seen a budget that was introduced in both the two versions as closely aligned as this one was. So they obviously wanted to get out of here quickly on time and really kind of streamline the negotiation process, because lots of the same language, new language that was the same, and same amounts and everything else. I mean, there were some differences that we will certainly go over, but it is the most closely aligned budget that I have ever seen introduced by both chambers of the legislature. And also feel free to, interrupt, raise a hand. I don't mind being interrupted, or put questions in the chat, and I'll try to keep that open so that I can see. So again, some of the big picture items for behavioral health, both versions of the budget did represent a cuts budget, which we were not surprised by. There were some alignments in those budgets, some of those top line alignments, 10% across the board cut to recovery navigator programs and lead and rest and jail alternatives. And so definitely not the best news, but really difficult to negotiate out of that when budgets are aligned like that. And so there is, like I said, that 10% across the board reduction. There was some differences in the budgets as well. The House went a step further on that, and it also actively reduced the admin positions at the BHASOs for recovery navigators. So that was a step that the Senate budget did not take. They did provide some flexibility in the House so that the BHASOs could backfill that with flexible dollars, but it does represent a cut on its surface by doing that. The House also had some further cuts to DBHR and to behavioral health that the Senate did not take. Like at the top of the mind, our minds over here at HCA, is the House had a 5% across the board FTE cut for DBHR. Which is a concerning cut over here. That one cut represented about, I think, 12 or 13 FTEs at the Division of Behavioral Health and Recovery. That's on top of a 3% administrative cut, which was to contracts, travel, overtime, other items that were that are noted in the budget. It does not specifically note FTEs, but I think to achieve that 3% cut, we are trying to figure out how we would do that without further FTE cuts. The Senate has a much more measured cut. It's 1.5% across the board on those administrative dollars, and again, is an admin and not an FTE cut. And so the House budget does go a lot deeper in the cuts territory for community behavioral health than the Senate. The House also took some other options and cut contracts. Some of our are direct contracts across the board. Some of those were like Clubhouse and Oxford House, I think, and so SUD Ed dollars that were also taken by the House of Representatives. And I think all told, there was about $8 million in cuts to contracts from the House budget. The Senate budget, while better, it did have some other targeted cuts that are concerning. One is the health engagement hubs. It cut the funding for health engagement hubs by 50% across the board. And so that was a deep cut to that particular service. So again, I think the top line here is while the budgets did cut, I think that we were mentally prepared for more drastic cuts. So that's the good news. And the opposite side of that is that the House, like I said, does represent a much deeper cut to behavioral health than the Senate. And it would be, it would create some pain for the agency and for behavioral health service delivery around the state if the House budget were adopted as it is right now. Any questions on budget items before we move along?
Sean, just real quick while people think of any questions, can you remind the group about like the next steps in the process, like the conference committee, and then like when we anticipate seeing like a final agreed upon budget?
Yeah, absolutely would be happy to do that. So the next steps is that the budget document is back over in the Senate. And so when a bill is amended, no matter if it's a budget or not, it goes back to the House of Origin, and the House of Origin can either concur or they dispute and go to conference. And so budgets always go to conference. And so there are 3 members appointed from each chamber that sit on the conference committee. It's always the chair of the Ways and Means and the Appropriations Committee. I think sometimes it's the majority leader, and then usually there's one minority individual on minority party, I should say, individual on the conference committee. And then they just hammer out, they negotiate what the final document's going to look like. Those negotiations are probably going to happen, in earnest over this week and over the weekend. We'll probably see some semblance of a final budget. I wouldn't anticipate it before the weekend. It's not unheard of, but I would guess it'll probably be sometime like Sunday or Monday. There are some just mechanical steps that have to happen to get the budget rolled off the floor by Thursday. And so usually we'll see that by that final budget document, the conference budget, my guess would be Monday, but it could be as late as Tuesday afternoon, and it could be as early as maybe Saturday. There is some strategic benefit to the legislature to not getting it out too early, because once it's out, it's very difficult to change that. And so it limits the amount of lobbying time, and that's just from being involved in the process. Like you don't want to give too much time for members to continue to go back and forth once a conference budget is out there. And so yeah, I wouldn't anticipate it much before Sunday or maybe Saturday, but like I said, it's probably going to be Sunday or Monday. And then they pass that budget, the conference budget, and they need to pass it clean. Otherwise, it just kind of starts that process over again of having to go back to conference. Any other questions on the budget? And to be clear, Sine Die is next Thursday. I might have buried the lead there. So Sine Die, last day of the legislative session. That is next Thursday. And technically it's 5 o'clock, but they always go past that.
Sean, thanks for that really helpful overview of the budget and the budget process. I know we have so many service providers and partners around the state that attend this meeting that are supporting these programs. And so I just want to acknowledge how difficult it is to hear these reductions being proposed. I didn't want to gloss over that because I know so many of us and so many of you have spent so much time supporting individuals, helping people find their path to wellness and recovery. And to see like the table I put in the chat, summarizing these proposed reductions and the extent of them in so many critical programs that are doing such amazing work across the state. I just want to thank you for your continued support for that work, your continued work around that population and the population that we've been talking about for the past 5 years. And just acknowledge that hearing this, seeing this, especially if it's for the first time, is really difficult. And we'll make sure and provide an updated information once there is a final budget about what actually lands and what we're looking at in terms of next steps. So I just wanted to mention.
And Tony, thank you for saying that. Yeah, it is. Yes, it is very, very difficult to see that. And especially when you've worked hard in previous sessions and everything, it is a little bit shocking to see that, oh, I've been putting so much effort into this. And then by the stroke of a pen or by a line item, that all can be erased. And that is a very difficult part of the legislative process. And sometimes I do gloss over that. So apologize for that. This might be a good time to also give you some context on, once budgets are out, how are agencies able to engage on the budget process? And so the short answer is, for the immediate, time period following budget proposals being made public, we are really in a implementation guidance and technical assistance mode. We are not really loose to start lobbying on budget items until, it'll probably be any day here where we are able to do some measured engagement with legislators on the actual impacts of cuts and start to really try to influence the budget just a little bit. Again, that's measured. It goes through OFM and the governor's office. And so most of the budget negotiation from this point forward is handled at the governor's office and OFM level. But the agency will start to work budget items in a measured fashion, probably starting in the next few days. But like I said, it's measured, and most of that is done by the governor's office at this point. There are some bills that are still alive as well that I'm prepared to go over, but again, want to provide an opportunity to ask questions about the budget before we move along.
Questions for Sean?
Okay. So, reflective of the budget situation that the state finds itself in, it was also a very low volume behavioral health policy bill year. It was like I went through some of the bills that are still alive this morning, and it's less than 10 that have significant impact that we are either engaging on or have engaged on or notice having impact in this space. One of them is House Bill 2168, and that has to do with the overdose mapping. So that bill is still moving through the system. The agency did provide some feedback on that bill early on in the process. Another bill still alive from last year is House Bill 1574, and that's the Good Samaritan protections. Rep. Macri's bill, that is still moving along. The prospects of that passing are looking pretty good this year. 2254 is an agency request bill on partnership access line funding dollars and administrative dollars. That one's still moving right along. The Children's Youth Behavioral Health Work Group bill scheduled for exec today, that one is still moving. And 6049, which is an OFM bill that also has the agency protection language for healthy youth survey data. That particular bill is still moving. So a few bills that are still moving through the process, but again, that volume is really down this year, and where we would normally be negotiating big policy bills, especially in the behavioral health space over the last several sessions, that's just not the case this year. Any questions there or any bills that I might have missed?
Sean,
Okay.
I think the one that's supporting Washington Thriving, we had Diana Cockrell and some of her team come and talk about the work that the Children Behavioral Health Work Group has done. Is that 6049?
That is 2254.
2054. Okay, great. I missed that. I was trying to put the links in the chat for anyone that's interested in kind of checking out the app.
Yeah.
Law.gov. And so that one's 2054. Okay.
2254. Sorry. Oh, nope. That's our agency request legislation. Children's Youth Behavioral Health Work Group is 2429. Sorry. So many numbers. I'll put it in the chat here.
Great, thank you so much. And yeah, so I just wanted to draw that parallel for the committee. That is the legislation that is supporting that work with Washington Thriving and the Children Behavioral Health Work Group. So I just, and then obviously 1574. Well, maybe not obviously. That was actually tied. Maybe not directly tied, but there was a SURSAC recommendation around amending the Good Samaritan law that actually was deferred, or was
It was voted down for the plan itself, but came out of one of the committees,
Yeah.
subcommittees.
In which subcommittee?
The outreach.
The outreach. So the outreach subcommittee put forth a proposal that the overall Substance Use Recovery Services Advisory Committee voted down, or I think the technical term was like deferred, basically saying like, maybe we'll consider this at a later time. And a lot of those recommendations within that are, at least within the previous version of 1574, I haven't looked at the most recent version, were adopted. And so just wanted to kind of flag that for the committee as well. And we will, maybe we can find that original recommendation. I think we have it on our website. We have it on the webpage.
It's not just Good Samaritan. It provides enhanced protections for individuals who are utilizing drug checking services, in addition to broadening facility types that can legally distribute risk reduction supplies as well. So there was a lot of things couched within 1574, lots of amendments, and closely related to multiple SURSAC recommendations, whether they passed out of the committee or not.
Awesome, really helpful. Thank you.
Yeah. Well, I have just a couple more minutes here. I might note that if you go through the budget, and especially like the agency recommendations and stuff, you'll see a lot of what might look like reductions to inpatient capacity and things like that. I don't think those are concerning at this point. I think that the treatment beds and things that you're seeing are reductions that are meant to mirror capacity demands right now. And so just putting out things that when beds are maybe a little behind schedule or something like that, if they don't actually take the step to save that money, they can't use that money somewhere else, and it just kind of sits in limbo. And so that might be a little concerning, but for the most part, I think these are all expected just maintenance level steps to reflect current demand and current capacity. And so they don't want to keep those dollars tied up. So maybe just a little clarity there. Anything else before I'll let you guys go? And I'd be remiss, I don't know, do we have any legislators on this morning? Any legislators that want to provide any maybe commentary to what I said? I know there's usually a couple in here. No, not today?
No, I don't think so today, at least not at the beginning of the meeting. And doing a quick look through the attendee list at this point, a couple hours later, I'm not seeing any.
They are busy today. There's no question about that.
Right.
So I'm not surprised. All right. Well, if anyone has any questions, y'all know how to get a hold of me. Feel free to shoot me an email. I'm happy to engage that way and try to provide any clarity that I'm able to. Hopefully that overview did provide some clarity and didn't increase any confusion. Yeah, thanks so much.
All right. Thanks so much, Sean. Thanks for being here. And thanks for your work.
We'll see you.
Thanks, Sean.
Adios.
All right, Tony, next up, public comment. So we'll call out again for any member of the public that would like to make a comment. Please raise your hand virtually. Again, calling for public comment. All right, Tony, looks like we don't have any takers here today, so we are at wrap up.
Okay. Sounds good. Thank you all so much. We have a couple of minutes, so maybe we can talk about the April meeting. We're going to get a lot of this information in the notes as well, and we'll try to get those sent out this week or early next week. I know a lot of information was shared today and a lot of links, and it's great just to have it all in one spot. And then the other action item follow-up that I have is once there is a final budget, we'll take a look through that. It may take a little bit of time because it's a pretty lengthy document, but we'll make sure and communicate with the committee kind of what the final reductions were that are tied to SURS plan recommendations. You know, like Sean mentioned, health engagement hubs, and the Senate has a proposed 50% reduction. The pre-program that's tied to a SURSAC recommendation as well has a 30% proposed reduction, and obviously our pre-booking diversion and community response efforts as well. And so we're obviously closely tracking all of that, understanding what an impact it would be, and we'll make sure and communicate when we have some more definitive information, because as Sean indicated, there's still a pretty lengthy process that's actually only going to take like a week to get to a final document that everyone's agreed upon in the legislature. So flagging those two action items, and then for the April meeting, I may not be here. Actually, just thinking about that's spring break. And my kids are getting older and they're about to leave the house, and we're going to do something, try to do something fun. They're turning 16 and 18. And so, well, 2 out of 3, one of them already left the house. Too much information nobody cares about. But regardless, April, I won't be here. So maybe Michelle, we haven't talked about this, so we're kind of ironing out some of the details. But what do we have for the agenda?
There will be, at that point, legislative session will be over, so we'll be able to do an overview of what has actually passed during the session. I think final budget, maybe, right? That would be known by then.
Yeah.
As well as a quarterly report for RNP.
Oh, that's right.
And then I think some feedback and updates from Yumiko or Atani regarding the substance use disorder prevalence and interactions reporting that HCA is submitting in July. So talking about what we've been up to with that and how we're collecting data, and requesting feedback from the committee members about how that's being implemented. And I think that's it. We may have room for another item.
Okay.
But it sounds like we may need to change the date for that one.
Yeah. Yeah, okay, so we'll circle back with the committee on the April meeting. We might have multiple staff unavailable that day, so maybe we can move it to a different day or postpone it a week. We did just have 2 back-to-back meetings within 4 weeks, so maybe a little, giving a little buffer there will be helpful. That SUD prevalence legislative report that's due to be submitted July 1st of this year, that is the legislative report that came out of 5536 when that was passed back in 2023. A lot of work has gone into that. We had Yumiko come and talk about like the initial report that was submitted, and then now we are expanding on that starting this year and then going forward. And so those reports just get more and more complicated. More and more detail, and so we definitely want to make sure there's enough time to get the committee up to speed on that. And we'll try to send out any materials beforehand, at least a couple weeks, which may also help with kind of postponing the April meeting to the 13th or maybe the 20th. And so we'll send out a poll to the committee. We want to make sure that if we're going to move the time of the meeting, that it's to a time that works for most of us. And we may keep it the same, and I might bring in someone else to help kind of facilitate it. We'll see what the options are and do whatever makes the most sense to ensure that we're not creating any unnecessary burden or reducing the ability of the committee to participate. So looking forward to that, and we'll have more information before then as well about the legislative session and any legislation that passed in the final budget. And I think that's it. Yeah, I can't think of any other housekeeping items. I appreciate everyone's time today. Appreciate the guests, the presenters, Tyron and Christopher and Chloe, and I'm Robin, and definitely Sean as well. So I hope everyone has a good rest of the day. Please find time to do something positive. Find time to take care of yourselves and the people that you care about and love. There's so much difficult stuff happening across the world. And, I usually don't kind of touch on some of the national or international events that are happening and try to keep it focused on the work that we're doing on. But it's getting increasingly difficult to do that. And so just want to encourage everyone to enjoy the weather today and take care of yourselves. And always reach out if you have any follow-up questions or any comments or suggestions about how we can facilitate this time in a more collaborative fashion. And we'll talk more about that as well at the next couple of meetings too. So with that, we'll go ahead and conclude the meeting, and I hope you all take care for the rest of the day, the rest of the week, the rest of the month, and we'll see you in April.
Thank you.
Thank you.